Hey everyone, it's finally Friday. And you know what that means? That means I'm on Facebook and I'm answering your questions. And I'm doing 6 questions now. I've been getting faster, answering questions like crazy. And I have your journal topic at the end, so stay tuned for that. So, the first question, drum roll please on my DSM, doesn't make quite the nice drum roll, is, can a person have more than one anxiety disorder? And the short answer is yes, you can. I actually had someone correct me on my Q&A video, and thank you so much for that. I'm always open to your guys' corrections. Sometimes I just get so many things going in my mind, I misspeak. So thanks for catching that. And if you guys are wondering what my error was, you can check the comments in my video from yesterday, and you can see that I talked about selective mutism, and instead of saying that if you talk, you can speak and then you decide not to speak due to a trauma, it can actually be an anxiety component as well, something that makes us really anxious and we can't talk around certain situations or certain people because our anxiety level is so high. So thank you so much for correcting me on that. I didn't realize I said that. With the anxiety disorders, let's say like the video I was talking about yesterday, someone was asking the difference between different anxiety disorders. And if let's say we have social phobia, like I was talking about yesterday, we can also have selective mutism, which is another anxiety disorder because they present differently and they have a totally separate set of diagnoses, okay? Or the criteria that we have to meet. Question number 2. I have a therapist who tears up when I tell her about things in my life. Is this normal? Is my life so bad that I'm making her cry? This is actually really interesting, and I'll give you 2 sides. On your side, on the client side, that's no, it's actually not anything to do with you, to be honest. It sounds like what your therapist is responding to is a little bit of what we call in the therapy world countertransference, where you may be talking about something sad, and I have a lot of clients like this. We'll be talking about really, really sad situations, and they cannot show any emotion because we're so disconnected from that situation that in order to feel something, we have to be connected. Does that make sense? So because we're disconnected, we may not express emotion. And that emotion that we should be feeling is actually what she's allowing herself to feel, which as a therapist, we're supposed to be trained enough. And this, I'm not saying she's not trained. I don't want to put her down because I don't think she's necessarily a bad therapist. I think that maybe she's overworked and she doesn't have enough separation between her therapeutic work and her life, because I find if I'm really maxed out, I can get tearful in sessions or fight the tearfulness in sessions because I'm supposed to be able to let you bounce things off of me and me say, I'm noticing that you're not expressing emotion. This makes me very sad, and be able to talk about it like that without getting emotional. So no, that's really not normal. It is a normal personal response, but in therapy, we're supposed to have boundaries and we're supposed to be able to allow you to reflect off of us and for us to tell you what we're experiencing without actually doing it. I know that's kind of difficult to understand. I hope that makes sense. Okay? Question number 3. What is the difference between PTSD and adjustment disorder? There seems to be a lot of overlap. Yes, there is. The main difference between PTSD and adjustment disorder is PTSD means that we have to have had a trauma that we have been exposed to, and that's why we're having all these stressors and flashbacks and nightmares or whatever it may be, whereas adjustment disorder, and I'm looking at my DSM because I don't want to misspeak, where if it's adjustment disorder, it is just a stressor. And I know that it sounds like, well, that's the same, but in a PTSD situation, it usually happens and then we have the response within 6 months, whereas adjustment disorder can happen all the time, and this stressor can keep coming up. It can be, let's say it's every day at work, we run into this person and it's really stressful, and so we have a psychological response to it. So that's the differentiation. I know it sounds very similar, but I hope that's clear. And it really, there's different subtypes under adjustment disorder, whereas PTSD is just PTSD, and but under adjustment disorder we can have depressed type, we can have, let me look, I'll read you a couple more options, with depressed mood, with mixed disturbance, with anxiety, with all sorts of different things. It can be acute, it can be chronic, and PTSD doesn't have all of those different types, okay? Now, number 4, how do I talk to my friend who I just told about my eating disorder, and she said that she has one too and that hers is much, much, much worse. And this person was saying that her friend seems to usually seek attention from others, whether it's positive or negative, and how do we talk to them? To be truthful, I know that she's your friend, but she's not really acting like one. And when it comes to your eating disorder, I would probably find someone else to talk to, someone else that is supportive, whether it's even a therapist or a dietitian or your doctor, or your parent who knows about it and is helping you, anybody who's supportive, because this person's actually not really helpful. They might be toxic to your recovery. But you could say, and I would actually encourage you to talk about it with her and just say, let's say, I'll say her name is Liz because I have a friend Liz and that makes it easy to pretend that I'm talking to Liz. So, hey Liz, yesterday I talked to you and I brought up something that was really hard for me to talk about, and it was something that's really secretive, and I found your response really hurtful. Can you tell me why you responded that way? I mean, that's kind of the way that I would talk about it. You could also say something to the effect of, I really came to you and I felt very vulnerable, and I was looking for support. Is that something you think you can give me for this? I mean, you can bring it up any way you're wanting, but like I said, I have a feeling this person's not going to be the best person to talk about your recovery to, because they're always going to try to one-up you, and eating disorders are very competitive, and that could just really hinder your recovery, okay? So be very careful. Protect yourself and your recovery. Okay, number 5, how do I go about making an appointment with you? I get this question a lot, and currently I'm not taking any new clients. I may open up a few more hours here. I'm hoping to hear from the BBS, so I have time to study, because I haven't been taking new clients for a while, so I'm not actually at full load anymore, but I'm hoping that then I'll be able to study for my exams and pass. Yay! But I haven't updated my office online either. I know, I'm sorry guys, but my office is on 7th Street in Santa Monica. Until I'm licensed and I can actually apply for insurances to accept me, I can't accept insurance. So I know those were a couple other questions that I get. But don't worry, I will let you all know. I will actually probably say it in a video once I've taken my exams, and you can all assume that once I've said I've passed both my exams, I'm licensed, yay, that then I'm opening it up to more clients, and you can contact me on any of my sites. I find Twitter to be the easiest to keep in touch with, and that's how you can make an appointment. And then we'll go from there, okay? Number 6, and my final question, what could you do to help you find the words in session? A lot of times I have so much to say, but I stutter and I can't think of the right way to say it. Is there a way to stop that? To be honest, a lot of it's comfortability with the therapist, and it can take a while. That's why a lot of times I'll have my clients write down the things they think about when they're on their own and they're feeling more relaxed and they're things they really want to talk about. And then you can bring that in and you can read from it, or you can give it to the therapist, and that can actually cut that out, that time to even stutter or be upset about it. And it allows her to know it, and then a lot of times our anxiety level goes down because she already knows that information, and we can talk about it a little bit freer. So I would practice journaling about it. You could even practice saying it out loud and how you want to say it. And then if you get too nervous in session, I would give it to her and help that move along. And I would also bring it up in session and just say, I have trouble finding the words. Sometimes I stutter and I don't get out what I want to say, and that's why I brought this, so that she knows, and then we can work on it, okay? Now the journal topic for today is, I love quotes, and I can't help but always look up motivational quotes and read them and, make journal topics about them. So the quote today is, if you don't design your own life plan, chances are you'll fall into someone else's. And guess what they have planned for you? Not much. And that's by Jim Rohn. And, we're all on our own path to recovery, and it's our own process, right? I'm always saying it's your own process. It's not perfection. So, and I'm reading my notes here because I think about this and then I write these things down. What can we do today to help ourselves better accept that? Is it positive self-talk? Is it standing up for ourselves? Is it reaching out for help? Even if someone's told us that we don't actually need the help, what can we do to create our own life plan and design it ourselves and realize that it's our own and it's wonderful and we're unique in that way, and we're going to work through it, So think of the things that you can do to kind of help keep designing your own life plan. And, can we do it? I think we can. So today I would like you to journal about some things that you can do to help design your own life plan and know that it's uniquely and wonderfully yours. Okay? Have a wonderful weekend, everyone. I love you all. It's finally Friday. So I got to get back to work. I did this in the middle of the day on a little break. So I'm off to the office, and I will see you all on Monday. Bye.